And now we will have actually, once again, Prof. Patrick Webb from Tufts University to address a plenary session on dietary patterns, sustainable diets, and health of the population. Shifting to sustainable and healthy dietary patterns can be achieved through effective transformation of food system interventions. The government of Jordan has emphasized its priorities for healthy and sustainable diets in its National Food Security Strategy 2021 to 2030 and Food-Based Dietary Guidelines 2020. Distinguished panelists will share with Dr. Patrick Webb their insights about that. And just to remind everybody and to encourage everybody, please stay with us till the end of the day. First of all, we have exceptional sessions after noon, after lunch, and then the Minister of Health, Prof. Firas Hawari, he will be here. He's insisted to be here to address how we could move forward after this very important symposium. So let's give Dr. Webb a very big round of applause.
Thank you. Hello, everyone, again, both in the room and online. Great to be here. Just one small note: our session, the program says lunch starts at 12:45, but it doesn't. It starts at 1 at the end of this particular session. So I'm going to invite the panelists, all three panelists, to come to the podium. We're going to have an interesting session here before we break for lunch. We've had a lot of talk so far, the first day and this morning, about pregnancy, about the young child, the infant, school age, now adolescent, as well as adults. Now we're going to broaden out into the bigger environment in which food and behaviors are framed, right? So it's both food patterns and behaviors in relation to our choices. And as we've heard in the last session, a lot of those choices leave a lot to be desired. So it's a great pleasure to have our three speakers. First, Mr. Raafat Alhalaki, head of the Imported Food Safety and Quality section at the Jordanian Food and Drug Administration. He's going to talk about some of the implications of food policies on the issues of overweight and obesity that we've been hearing about. So please.
Thank you. Thank you, Dr. Patrick. Our discussion today now about food policies and their implication in overweight and obesity trend. Introduction: overweight, obesity, and NCDs account for 4 million deaths each year. Near East and North Africa has relatively high rates of obesity and overweight compared to other regions. During COVID-19, fatality rate in patient was high. Fatality rate increased in obese patients. As we see here, our region is in red, which represent the highest rate of body mass index all over the world. Body mass index and obesity rate increased since 1975, as shown here in the figure. Not only urban population, also rural population has the same problem. And Jordan, as you see, has the same rate of obesity and BMI. There are several explanations for high rates of obesity: urbanization, nutrition transition, changing in lifestyle, and reduction of physical activity, all related to obesity. Trade, food policies, and nutritional implication, Jordan and other countries. Food policies mainly trade associated with body weight outcome. Trade policies influence domestic food environment. Importation, liberalization, and large supermarkets increase consumption of unhealthy food. As we see here, trade policies and food policies all go to food production and food in the market. This will affect the food security here in Jordan, and this lead to overweight and obesity. This figure shows that Jordan dependency on importation increased over the years. From 1975, it's the highest level of importation. Evolution of food system in Jordan. Jordan started subsidized food in 1970s. In 1996, subsidized reforms of bread lead to what we call it bread riots. In 2000, Jordan liberalized trade and importation was increased. In 2018, government introduced 10% tax on agricultural inputs and outputs. As we can see here, imported food is a major import to Jordanian markets. Empirical relationship between trade food policies and body weight in Jordan. Low tariff and high subsidies associated with food supply, which is positively associated with body weight. As we can see here, the lower tariff and high subsidies related with high overweight and body mass index. The above one is the tariff. The maximum tariff in the food, the lower body mass index. And subsidize on the food, the more subsidized which put in the products or given to people, the more overweight and body mass index. As we can see here, the price of sugar inversely associated with body weight. Summary and policy recommendation. The increasing in obesity rates call for integrated intervention. For example, designing nutrition-sensitive trade policies. Alternative form of taxes on energy-dense food. Saudi Arabia, as an example, recently excess tax on sugar-sweetened beverage. Also, healthy and subsidized to produce healthy and nutrition food products. The situation after COVID-19, still we need research after COVID-19 situation. Also, we need research on trade overweight impact of COVID-19. Thank you.
Thank you so much, Raafat, for bringing in that economic dimension and some of those kind of graphics that we haven't seen yet, right? The inverse relationship between tariffs and anthropometry. I mean, it's something we can certainly discuss more in the Q&A. So I'm going to hand next to Dr. Kablan, Ahmed Kablan, from USAID's Bureau for Resilience and Food Security in Washington, D.C., in headquarters. He's going to talk about one of the issues that I raised yesterday, the issue of food loss and waste in Jordan, and its potential for making a contribution to increasing the healthiness of the food supply. Ahmed.
Thank you, Dr. Webb, for the introduction, and it's great to be here. Assalamu alaikum wa rahmatullahi wa barakatuh. My talk will be, could you please project the slides? Okay, thank you. About the contribution of food systems and the role of food loss and waste that could play in addressing some of the vulnerabilities in the food systems and food prices, as well as improving affordability. In assessing the entire food system, we can identify a more nuanced set of challenges and sharpen our focus on the dynamics and connections within the food system. The food system offered both challenges and opportunities for maximizing our impact on vulnerable people around the world. We are focused on approaches that increase the resilience, meaning that we help countries withstand shocks and stresses and stay out of poverty when hard times hit. Drive inclusive growth and employment, advance women's economic security, improve access to nutritious food, and directly address emissions in the food systems. Food, for example, food systems contribute to about 30% of all global greenhouse gas emissions, but can also be part of the solution to climate change. We need to make food systems more inclusive, more resilient, sustainable, and to climate change, and be able to feed the growing population. But why we care about climate change? We are in a nutrition symposium. Why does it matter? I want just to bring your attention to 3 facts and 3 priorities. The 3 facts that we have due to climate change. Climate crisis is undermining the systems, especially food systems and the health systems that mothers and children rely on for health and survival. The global food systems is a major contributor of greenhouse gas emission, contributing about 1/3 of the total greenhouse gas emission. Those suffering the most from the nutritionally impact due to climate change, such as the infants and mothers, are those contributing the least to greenhouse gas emissions. The 3 priorities that we all should be focusing on: accelerating action to safeguard and improve nutrition for mother and children, those most affected by climate crisis; support food system action that reduce environmental impact while improving access to safe, affordable, and nutritious diet; and finally, support climate policies that reduce inequities and strive for climate justice. A recent publication found that a 2 degrees increase in temperature will increase the prevalence of stunting by 7.4 percentage points, reversing the progress made on improving nutrition and our work globally. Currently, the global is projected to be 9.2 billion by 2050, 8 billion of those living in low and middle income countries. 60% more food will be needed, and the size of agricultural land is growing smaller. The impact of urbanization, climate change, refugee crisis, wars such as the current Russian invasion for Ukraine, all of those form the perfect storm that could render our systems unable to deal with this growing populations. And we have still, with all of this, have food loss and waste. How do we find, or what do we mean by food loss and waste? For those who are not familiar with the terminology, technically speaking, food loss and waste refer to the decrease in the mass or the quantities or nutritional value, which means the quality of the food, the edible part through the supply chain that was intended for human consumptions. Food that was originally meant for humans to consume, but for various reasons it's been removed from the human food chain, is considered a food loss or waste, even if it's directly not used for human or used for other purposes such as feed or bioenergy. 32% of the global food supply is lost or wasted by weight, or that translates to 24% of the global food supply energy by calories. And to talk about the impact of food loss and waste in terms of greenhouse gas emission, about 10% of global greenhouse gas emission is emitted by food loss and waste, which is equal to the transportation sector. If food loss and waste was its own country, it would be number 3 after China and the United States in terms of greenhouse gas emission. Additionally, food loss and waste exacerbate other problems and result in toxins and other food safety incidents in the food system and the value chains. The accumulation of mycotoxins, for example, which are natural occurring toxins produced by fungus, Aspergillus flavulus, in the soil, will increase with increasing temperature. If we look at the heat map that is produced looking at the trends in aflatoxin production with increasing temperature, we can see as the temperature rise, more aflatoxin will be produced in crops, and those impacted the most are also those who have suffered the most from malnutrition currently. Food is lost or wasted along the whole or the entire value chain, starting from productions, handling and storage, processing and packaging, distribution and market, and consumptions. Food post-harvest losses stop when the food leaves the farm gate, and that's where we start the food waste. And that is the majority of the food in Jordan is being wasted more than lost. All countries contribute to food loss and waste, but in varying ways and degrees. As you can see in the figure, depending on where you move in the income gradient, whether from low to middle or high income, the contributions in the food post-harvest losses or food waste depend on the production side or the harvest, storage, transportation. But on average, every country or all the region in the world contribute about 30 to 33% of global food loss and waste, or food loss and waste from the global food produced. And cereals, as you can see, they comprise the most food loss and waste when measured when we are looking at calories, while fruit and vegetables are the most food wasted or lost when we are looking at the absolute weight. All of this food is lost in a waste, or all of this micronutrient, macronutrient, and calories lost or wasted, while the global numbers of undernutrition is increasing globally. Addressing food loss and waste requires looking at the gaps and the point where food loss and waste is happening. Analysis strategies for intervention should be done at the country level. I'm giving here two examples for two different countries on tomatoes value chain. In Nigeria, 50% of reduction in food loss and waste will happen at the transport, handling, and storage stage. And that will increase the affordability of tomatoes by 20%, according to the World Bank report. In Rwanda, however, 50% reduction in food loss and waste at the retail and farm gate will increase the affordability of tomatoes by 23%. As you can see, addressing food system inefficiencies in the form of food loss and waste will make nutritious foods more affordable. Food loss and waste in the context of Jordan, why does it matter? In Jordan, we have about 1,377,000 tons of food lost or wasted annually. The majority of this happening at the household level, about 68%, and at the food service, which means hotels, restaurants, etc. And finally, the retail has the lowest amount of food waste. Also, as you all know, food loss and waste is not only the waste of food, it's also wasting of the resources used to produce the food. Water is one of the main resources that is used or is wasted that we worry about. And as we know, Jordan is a water-stressed country. Renewable water supply currently meet around 2/3 of the population water demand. Demand centers are far from water sources, and about 40% of water sources are transboundary. Groundwater is being used as twice as quickly as can be replenished in Jordan, while we are wasting, or in Jordan we're wasting a significant amount of food that is produced by this very extremely rare resource. Additionally, as my colleague, the previous speaker highlighted, we are importing a lot of food. And in Jordan, the value of food imported in 2018 was $1 billion and 320 million. If only 30% of imported food is lost or wasted, that translates to about $40 million of hard currency that is lost or wasted in Jordan. In 2016, the Jordan Green Building Council, which is a non-profit organization, found that waste in Jordan ranges between 50 to 65%, which is greater than the international level of 33%. Also, the Jordan Green Building Council found that bread was the only food item that is recollected from dumpsters and used for animal feed. Musa Ital highlighted in addition a higher rate of food waste or disposal in Jordan was seen during Ramadan. She highlighted, or she found estimated about 600 tons daily of food are wasted in Ramadan, while we're having families who are suffering from malnutrition and hunger and unable to access food also during the holy month of Ramadan. The household level of food waste about in the MENA region, in general, if we look at comparing Jordan compared to the MENA region, about 34% of food in MENA is wasted, 44% is lost according to UNEP. Minimal public awareness of the problem and the possibility of actions, and with that we'll talk about it in a minute in food loss and waste hierarchy. The problem also, the credible data and the quality of data in Jordan or in the MENA region is weak. Saudi Arabia, for example, only, it's one of these exceptions that invested extensively to measurement of their food waste. Looking at the nutritional status in Jordan and the metrics of food insecurity, according to the report that published by Food and Agriculture Organization, FAO, which is called the State of Food and Insecurity in 2022, Jordan was found to have higher rate, or as you can see, the prevalence of undernutrition comparing between 2004 and 2019 are increasing. The prevalence of severe food insecurity and moderate to severe food insecurity are increasing. The prevalence of stunting is remaining plus minus and plateau. There is no change in it, but overweight and obesity are increasing in Jordan, as well as anemia in pregnant lactating women and children are increasing in Jordan, while between 2004 to 2019. Additionally, the report looked at the cost of healthy diet. Between 2017 to 2020, you can see a steady increase in the cost of healthy, affordable, or the affordability of healthy diet in Jordan, which means the food become unaffordable. As of this report, which is the data by 2020, about 15% of Jordanians, they cannot afford or they are unable to afford a healthy diet. And that leads to Jordanians consuming lower amount of fruit, milk, and product, beef and lamb, compared with what is recommended. And this inadequate intake and increased consumption of carbohydrate and bread may dispose individuals in nutritional deficiencies such as iron, calcium, and anemia, and vitamin B. Therefore, solutions should be implemented to alleviate the adverse health effect of food inefficiency by improving or reducing food loss and waste. Malnutrition in the Arab region, I'm not going to go into details in this slide, it's self-explanatory. Factors adding pressure to the Jordanian food systems, the fast-growing or the explosion in population growth, refugees added pressure, and the food insecurity among refugees, climate change, water shortages, additionally food loss and waste, as we mentioned, contribute significantly to the food system inefficiencies. What we can do about food loss and waste, we have problem. We can look at the hierarchy, prevention, redistribution, repurposing of the food, and finally, don't let it in the landfill. You can feed it to insect and harvest that insect as an insect protein that's useful for human and animal consumptions. Policies that the government of Jordan could take to reduce food loss and waste: improving food production system to minimize food loss, including post-harvest losses, displaying fines or taxes, tax credit for businesses that donate food, supporting food rescue and redistribution of businesses for NGOs, monetizing greenhouse gas emissions and averting methane emissions by reducing food loss and waste. Jordan is a signatory on the Global Methane Pledge, which commit to reducing methane emission by at least 30% by 2030. Methane is the most harmful gas that increases temperatures. Finally, we can look at actions, Target Measure Act, the method developed by WRI, which means identify the target you want to achieve, identify ways to measure this target and act on it. And Jordan have developed in their Jordan Pathways that Dr. Webb highlighted yesterday to sustainable food system or transition of the food system as a sustainable, resilient food system by 2030. One of these action items he highlights were the reduction of food loss and waste. And finally, just to highlight how USAID is addressing food loss and waste, and at the UN Food System Summit 2021, the White House announced USAID will invest $60 million over 5 years in new research award that will contribute to critical solution to reduce food loss and waste. One of those was the Food System for Nutrition Innovation Lab that Dr. Webb and Dr. Ghosh are the director and co-directors. The United States joined the Food is Never a Waste coalition that was launched at the United Nations Food System Summit. USAID joined the Friend of Champions 12.3, which is a group of champions dedicated to achieving the Sustainable Development Goals, the SDG 12.3, that aims to cut food loss and waste by half 2030. USAID established mission up standards that will not stand by food loss and waste. They will act in reducing food loss and waste. Finally, we developed food loss and waste community practice. And fact sheet, if you are interested to join it, please send an email to reducefoodloss-and-waste@usaid.gov. Thank you so much for your time, and I think I made it on 20 seconds late.
Thank you, Dr. Kablan. That was a lot of material in a very short time. And I'm sure there are going to be a lot of questions and comments in relation to that afterwards. And thank you for highlighting one important issue, data gaps. And there's an old conventional wisdom in the business world that you manage what you measure. And if you don't measure something, you typically don't manage it very well. So that highlights the importance of everything that we do to ensure we have the right kinds of data, something that this symposium is talking about, but also better understanding and better assessing of what foods are consumed and what foods are not consumed, which leads us to the next speaker, Sabah Barigou. Please tell us a bit more about the Fill the Nutrient Gap initiative at the World Food Programme.
Thank you, Dr. Webb, for the introduction. Good afternoon. So I know that this presentation is just before lunch, so please bear with me. So as Dr. Webb mentioned, I will present you the Fill the Nutrient Gap analysis. So I will try to manage this slideshow. Yes. So I'm good at it. Okay, so as we all know, adequate nutrition is about consuming more than 40 nutrients in different amounts from the right and wide variety of foods, and those amounts, they also differ for different target groups. Nutrient density for a young child is much higher than adults. Diets are part of underpinning factors for all forms of malnutrition. Meeting nutrient requirements is a prerequisite for ending all forms of malnutrition. We, of course, acknowledge the importance of disease for malnutrition, but we also need to focus on inadequate diets. Fill the nutrient gap, and you will hear a lot the acronym FNG during my presentation, is about tuning in the inadequate dietary intake. So there is two direct causes of malnutrition, as you can see in this slide, and as you all know. It's inadequate dietary intake and disease. And what FNG does is unpack the inadequate dietary intake. I think we heard from Dr. Webb, but also Dr. Shibani and many other speakers, that there is a very high unaffordability of nutritious and healthy diets all over the world, but also in Jordan. And we also heard by the previous presenters that 15% of Jordanian population cannot afford healthy diets. We also know that non-affordability of nutritious diet is associated with different dietary quality and nutrition outcomes. MDD is a good proxy indicator for micronutrient adequacy of the diet and complementary feeding practices. We have also seen a strong relationship between non-affordability and stunting. More and more, evidence shows that systems approach is required for healthy diets. As you can see in this slide, we speak about the food system, the health system, social protection, health, education system are really key to support access, availability, affordability of healthy diets and better nutrition. As you can see in this slide, there is also the social behavior change component that is also really important. So what is the FNG? The FNG is a systems-focused situation analysis that was conducted in more than 50 countries all over the world, and 10 more are ongoing, for nutrition that supports reaching the SDG 2, zero hunger, with a specific focus on some indicator 2.2 that we all know, ending malnutrition in all its forms. The FNG contributes to strengthen the nutritional analysis and to better understand from a multi-sectoral point of view the cost-effective policy and programmatic strategies in order to improve nutrition of key target groups in their particular context. The FNG aims to identify and characterize the barriers to nutrient intake, to determine gaps in dietary intake, to inform national policies and actions, to improve nutrition with a specific focus to the most nutritionally vulnerable groups. So we start by clarifying the magnitude and the nature of nutrient gap. We look across the entire food system. So we look at availability. We ask the question, are diverse foods available locally to meet the nutrient needs? Characterizing the production and the supply side of the food system. We also try to understand better the food environment, and we had quite a number of presentations and evidence that this is critical. Where and how people interact with the food system, how they obtain their food. Is processed food in Jordan cheaper or more expensive compared to fresh foods, to fresh vegetables, to iron-rich foods? We look at access. Do people have physical access to the markets? Are markets functioning? Is transportation available? Are there cultural norms that prevent movement for specific groups? We look at affordability. Are nutritious food affordable to most people? But we know where the people who cannot afford these nutritious foods, we look at where they are, in which specific areas of the country. This is a major component of FNG. We also look at consumer behavior and food choices. Given the options that people have, which do they select and how are these choices made? Then we ask the question, how can those choice options be broadened across systems? The health, the social protection, the education, the food systems. Then we model different potential interventions that are existing or need to be strengthened, and potential programs and national policies that can help improve this access, availability, and affordability of nutritious food. You can see in this slide also the different partners with whom we have developed the FNG, such as UNICEF and others, and different universities like the California University. And we are also supported financially with different donors from Canada and Germany. Importantly, the FNG involves all stakeholders, led by the government, across those systems, to ensure understanding of issues, to prioritize potential solutions, and to ensure that these solutions are sustainable. So let's come now to the methodology itself of the analysis. The analysis has two components. The first one is a secondary data analysis and review to have a comprehensive understanding of the situation and factors that impact whether nutritious foods are available, accessible, and chosen for consumption. In Jordan, we know that there are lots of evidence and lots of data available to conduct this secondary data analysis. The secondary data analysis go through all the different components of the food system, the food supply chain, the food environment, the consumer behavior, to really look at each of the different components. The second element of the methodology is a linear programming on cost of the diet. We use a cost of the diet software and is an optimization developed by Save the Children UK that allows us to obtain the cheapest combination of available foods that meets macro and micronutrient requirements for model household. And we look at these in different locations of a country, in different areas. Rural versus urban, but also in different locations of the country. As I said, based on the findings and the input from different stakeholders, we then model context-appropriate interventions that aim to improve this access, affordability of nutritious diets, but also nutrient intake across these different systems: food, health, education, and social protection systems. I will not go too much into the detail of the cost of the diet, as you can see it in the slide. But we also compare the cost to the household food expenditure to estimate how many could afford it in more specific locations. What is really also important is to target the most nutritionally vulnerable population. That's why the FNG is really looking at a household of 5 persons, and we capture the most vulnerable in this household, including for sure the child, the school-age children, the adolescent girls, the lactating and pregnant women, and we can also look at the adult men across the life cycle. So we look at 2 different types of diet, the energy-only diet, but also the nutritious diet. And in many countries, the energy-only diet is also not affordable. So as I just mentioned, the FNG estimates the cost of 3 different diets: the nutritious diet, the energy diet, but also the healthy diet. So how can the FNG inform the different national systems and the different national processes? We've seen in many countries, so there are different contexts that require different packages. There are countries where there is a very high non-affordability and low capacity into the systems to respond to that. And there are other contexts where the non-affordability may be a little bit lower, but where there is a clear need of strengthening all these different systems, especially the food systems, with functioning markets. And it's, for example, in this second different context, we look more at strengthening, for example, the different systems, but also the national fortification scale. We heard from His Excellency, the Minister of Health, how the fortification program in Jordan is really effective. But there are different other components that we can look at, such as the retail and the private sector. As an example, in Pakistan or in different other middle-income countries where the FNG was conducted, it really informed the National Social Protection Scheme that was targeted the pregnant, lactating women and children below 2 years. And like in Pakistan, the government decided to adjust this social protection scheme to consider the result of fill the nutrient gap. And how the FNG can really support Jordan. Definitely, the FNG could support improving the affordability and the access of nutritious foods, increase the household purchasing power, target the most vulnerable individuals with specific interventions, increase nutrient content of food, or increase availability of nutritious foods. But more importantly, what we understood from different presenters could also support the implementation of the National Food Security Strategy. Thank you.
Merci, Sabah. Thank you so much, for all three of you, for being very much on time. And we had three very, very complementary presentations here. We have plenty of time for Q&A and discussion, which is a luxury we don't always have. So, first question over there, please.
Hi, my name is Nara from UNRWA. My question is to Ahmed. Mm-hmm. So you mentioned, correct me if I'm wrong, you mentioned that the food waste in Jordan was 66% from household, correct? And so my question is for you, other than advocacy and awareness and education, all the stuff for the household not to waste food and find other resources that other than wasting food. So what's your intake of reducing food waste at household, especially there's not much recycle options, lack of efficient recycle options in Jordan?
Yeah, thank you. That's a good question. And in Jordan, as you mentioned, the biggest component of food waste have in the household. And other than the items, which is looking at food loss and waste hierarchy, we need to think about purchasing what we need, serving ourselves what we need, and that's part of the behavior change. So a lot of these problems happens when you have a guest. I remember it, I have not lived in Jordan for about 20 years, but from what I remember, you have 2 guests coming, you are making food for 20 people. Because the more food is made, the more wajaha it is to show, and more respect for the guest. We want to move away from this. We just want to we have 2 guests, make enough food for 2, maybe 2.5. But also, saving the food scrap is not a wasted food, it's not a bad food. So serving the food in a way that ensure that the food is safe, not contaminated, touched, and saving even a bite or whatever small amount of food left, that should not go to waste. And at the same time, people intend, not only in Jordan but globally, when they see a discount on certain food commodity, they go buy a lot of it. That will end essentially, we are moving it from a retail waste to a household level waste. If there is no way to absorb that much food and consume it while the food is still good, we should not be buying that much. And I'm talking here about not staples, not wheat or flour or rice, etc., because those you can save them for a longer time. I'm talking about the most nutritious food, fruit, vegetables, dairy product, etc. Those are the most foods are being lost or wasted in Jordan and globally. For about 45% fruit and vegetables globally are lost or wasted. Thank you.
Largely because they're more perishable, and so technology and innovation as well as practice needs to be applied there. Yes, second.
Okay, I'm Shema Shadirma. Thank you for your nice presentation for all Just I have one question. When we talk about the sustainability, a lot of things, we know we have a lot of challenges in Jordan, and we see a lot of programs that supports the youth to make innovation idea and applied some business in agriculture, because we have a lot of a problem in food security in Jordan. So what's your recommendation for the youth and decision maker to make a reality difference? Because we listen more and more about sustainability, food security, but we don't see the reality difference in Jordan, to be honest. So what's your recommendation? Because we see a lot of support for the businesses, but we start about small business and we finish. We don't have sustainable programs to support the sustainable issues. So what's your recommendation?
Is that to one person or to the panel?
For anyone
For
who
everyone.
can answer
So
that.
would you like, I'll ask each of you to respond. It's a broad
The
question.
idea,
Yep, that's okay.
the idea of applying food policies, government can't apply these policies because people will get angry or happen something that make this job stop. As we know, if we want to put tax on sugary food or any food, people start to be angry, and government don't want to get angry by the people. If we want to give subsidies to healthy food, problem will happen. This money did not go to the right people, and people start to get angry, and government don't want the people to get angry. So this sustainability and decision should be a policy, how to build a good policy and how to apply it, or how to inform all the people that we have a problem with overweight. So we need to put healthy food in the market and should not consume sugar and salt and any unhealthy food and energy dense food. This is like a building. Government should build it in the right way and should share information with all the people.
Thank you, Dr. Before I ask the others also to respond to that question, no government wants to make their people angry, that's for sure. But aside from taxes, is there any discussion of selective tariffs, right? Higher tariffs for certain unhealthy foods, lower tariffs for healthy foods. Is that a discussion, an option?
Yes, but making tariff on food and medicine especially, it's not acceptable for the people. So any government want to put tax on the food, they reconsider the decision before they put it. So this issue, you have to inform the people that people eat unhealthy food before they put any tax. Not because we want to collect money. This is not, it's not acceptable to the people. The people should know that we put this for you, for your health, before they make the decision.
We have a lot to do there. Sabah.
Thank you. Yeah, I think it's a really, really good question. I think once the key and the important element, just to take from the idea of what it just said, what is really important is about people also. The demand is really critical. The demand is really critical. Demand for healthy diets. The demand is for sure is about awareness, is about SPCC, but it's not all about that. Even if I know that I have to eat better, or if I know that my child needs to eat better for his health, I need to make sure that I can find these foods. Availability, affordability is also critical. And it's all about having all of these sectors together to find a consensus all together. Nutrition is about everyone concerned. It's not about me as the mother, it's about everyone concerned, all sectors concerned. All the sectors could really provide a contribution to that. But it has also to come from people, because what people want, the demand is really key, but you need to have the supply also that could follow the demand. So all of this is really critical.
Yeah.
Thank you.
Thanks, Sabah. There needs to be alignment of sector strategies, but there also needs to be alignment of objectives within a household. That's the thing. We'll be right there, but Ahmed, on that same question.
Yeah, I want to touch on the point of the youth and youth encouragement, women and youth in this work. First of all, food loss and waste reducing actions, they are inherently income-generating activities. So just creative ways of addressing food loss and waste, whether recapturing, recycling, redistribution, collecting food, whether as a private sector company, and then if you think about trying to link it with how much greenhouse gas emission you are averting when you are collecting or reducing food waste, and then try to sell that carbon credit to companies that are looking to take credit or reducing their carbon footprint. That could be an idea that was income generation for you. Of course, we need an enabling environment for the youth and the women, especially young women, to be independent and to take on business ideas. That's where the role of policies that could be coming from the government on microfinancing or affordable financing, where you don't need to take 100,000 JDs loan, you just need a smaller loan that will get you off the ground, and then you can come with ideas to sustain yourself. And look for opportunities from other resources other than banks, or look, for example, competition prizes that will say, if you achieve this goal, and we have, for example, DC and USAID DC, we have several programs that we say, if you achieve this target, it's not geography bound, it is more of a target achieved in certain sector, then you will win this much prize. So you need initial investment capital, but if you achieve it, you are winning this prize. At USAID, we are focusing on inclusive development, and part of inclusive development is youth, is the core for that. Youth, women, indigenous people, marginalized are part of that, as a core for it. As well as we are trying to advance and implement in full our localization, which means looking at local implementers, local NGOs, local private sector companies, to implement our work in order to ensure it is sustainable, because donor funds dries out, donors priority change, but we want the work we do it today to last until tomorrow and the day after tomorrow for generation to come. Thank you.
Thanks, Ahmed. Sama.
Thank you. Good afternoon, everyone. I think Dr. Sabah has took the words out of my mouth. So thank you. I wanted to highlight that when we work on service delivery in general, or the availability of resources in general, it must go in parallel with demand generation. Mm-hmm. And as long as we all collectively work on raising awareness and making sure that information, because again, this is a scientific symposium, and this is one step towards information sharing and dissemination, to strengthening and empower people and communities to take decision. In addition, I wanted also to touch base on the importance of the concept of shared responsibilities. We always, and to complement what has been shared, we always put the burden on the government. We always demand from the government. We always say, we want lower prices, we want more affordable options, and so on. But it's a shared responsibility between everyone, the community as a consumer, private sector, investment, whether internal or external, and the government. I think when we look at any strategic initiative as what we are talking about, whether food security, diet, nutrition, etc., we should look into all pillars to the maximum equilibrium that we can get. So we work on service delivery, we work on demand generation, in parallel with enabling environment and the supply of all the resources that are needed. Yeah. So thank you.
Very well put. Couldn't agree more. Further questions? There's a hand over here.
Hello, I have a question for Dr. Ahmed. Since we talked about the topic of food waste, why don't we take the food waste, or take the part of countries, for example, the US, who has a very high rate of food waste and obesity, and it would be not fair for countries who suffer malnutrition. So how can we do an initiative or a solution for this problem of comparing where countries have very high food wastage and other countries who have no accessibility to food?
I'm not sure if I understood your question correctly, but you are asking about looking at food waste or looking at the countries that have higher food waste as well as higher other health problems or such as nutrition, malnutrition. As I showed in one of my slides, the burden of food loss and waste. So we're looking at post-harvest, before you harvest it while it is in the ground, when you harvest it all the way until the farm gate, and then that is the food loss, the food loss. And then after it leave the farm gate, go to retailers, consumers, etc., that is the food waste. Globally, it is on average goes across countries about 33% every country contributing to it, where in low-income countries, the more on the pre and post-harvest due to disease, infestation, lack of mechanization and technologies to harvest the food and to transport and to save it. And then we move to higher income, middle to high income, the food waste become more because now they can afford more food, but also at the same time they're wasting more food. That's why in either sector, whether it is a post-harvest or a pre-harvest or a food waste, we need to look at how we can recapture this. Recapturing food loss and waste, whether we want to redistribute it, use it for animal feed if it's not suitable for human, or instead of just throwing it in the dumpsters and the trash, donate it or find a business. There is some business models in the US, for example, a food bank, where they have established their business model on taking these meals, extra meal from food industry, services, retailers, etc., redistributing it to those in need, generating an income because they are taking the food from you instead of you throwing it away and giving you the carbon credit. So that this food is for free and it's given for free. They're generating income by you paying, as a retailer, you're paying them to take the food away from you instead of wasting it, and you are taking credit for that. And you are being highlighted in a lot of government initiatives. For example, in the US, USDA, they have in the private sector program called the Champions, or Food Loss and Waste Champions, that companies sign up to become a champions, which means they are committed to reducing food waste. Thank you.
One of the ironies, yes, Mike here, is that it's universally true that as individuals or households get less poor, they become richer, they spend more in absolute terms on food, but relatively less on food compared to total expenditure. And so part of the answer is reconnecting with the value, the true value of our food. Because as we spend less and less on food as our in relation to total expenditure, the value of that food can be lost. And so there are cultural dimensions there. But please.
Thank you for everybody who present a very nice and interesting topic. And I think everybody in this room concerned about food waste. Maybe little comments about the household, which we have a very high percentage on food waste. Do you think that this wasted is not only the personality or the responsibility for the one in the household, as in the industry of food and agriculture, you find in market there is some policy or some issue related to marketing and related to the price of food. So they serve for family, not for individual. If you go for the market in Jordan asking for one portion for one person or two, they say, whoa, we don't have this. We have to take this, the whole bunch of a bread for the whole family. So when you buy it, have it in the refrigerator. After 2 or 3 days, it will be wasted. So as the previous maybe comments say, it's a shared responsibility, but there is a big issue on the market of food and the agriculture thing, where the like put it for people. They concern for family, not individual. If you have a small family, 1 or 2 or 3, you can't find like in the market where you can buy this portion for only 2 or 3 people. Just for comment, and please, if you can, just like articulate it about this point. Where is the role of the industry and the marketing for food in Jordan? Thank you.
Thank you. I do see in the table behind one that's going to be the last question, and then I'll ask each of you to respond to both.
Hello, my name is Reini Karam. I have a question for the panel. Is it possible to develop programs or organizations that help, especially in Jordan maybe, since the highest food waste in Jordan is due to households? Is it possible to develop programs that help in recycling the food into fertilizers? We know that due to overproduction, nutrients are being depleted from the soil too. So at least for the to think for about the future generations and the future production of food, highly dense nutrient food, is it possible to develop, or is this option? Could we develop this option later on?
Thank you. Yeah, options, incentives, approaches, behaviors. We'll go each of you in turn.
Yeah, thank you. To answer the first questions, you are correct. It is a shared responsibility for everyone. So essentially, we want the food industry, the retailers, to have packaging of appropriate sizes. So which will enable you as a consumer, instead of buying 10 kgs of something, you can just buy 1 piece of apple because that's what you need that day, for example. And that is where you go, for example, to Europe, to US, and other countries. You go to the grocery store and you can pick how much you want to buy. The same thing goes for the incentive from the government in terms of what could be part of the action or policies to provide incentives. However, it can be this incentive format to the retailers who are acting to reducing food loss and waste, creating a recapture facilities or a way to donate this food. There is some organization, NGOs, Islamic foundations in Jordan that they collect 60,000 meals or more by just working with a couple of hotels or restaurants to recapture this food. The same thing at the household level, you can work, or there should be some way to capture this a significant portion of food waste in the household in that form. In the composting or in the creating of organic compost, that is something which is, apologize, I did not go in details in the food loss and waste hierarchy, but it is in the slide there. I think they will be shared with you, with everyone. The hierarchy, we go to the first one in the top, to prevent food loss and waste. So prevention is the best thing. Second thing, redistribution, so redistribute it in the surplus food and waste for human consumption from one place to another. Repurposing the food that's not suitable for human consumption for animal feed. And repurposes for industry, so moving it, or food processing essentially. Instead of keeping everything as fresh, you can minimally process the food, canning, etc. So you are conserving the food from being wasted. And then we come to composting, creating a compost that food that inedible, that instead of wasting eggshells is considered a food waste, for example. So all of these things can be composted and brought back to the soil. Another agriculture practice which is called sustainable intensification, where you are using for the ground agricultural land where you're producing food, a coverage crop. Coverage crop is just a crop that is not meant to be eaten. It just, you essentially, once grown, you plow it down in the soil, you break it down, and you plant in there. That coverage crop will help the soil retain nutrient and water, etc., and encourage the growth, increase the soil nutrient content. So there are several approaches where we can prevent or act to reduce food waste and loss as well, and increase soil fertility. Thank you.
Thanks, Ahmed. Sabah.
No, maybe just to add and answer to the first point, I think it's a really important point, and I think the field the nutrient gap is really looking also at the food environment and the specificity of the packaging that you exactly mentioned and what it entails in terms of the food consumption of people is also really critical. So it's just to mention that.
Thanks.
I want to answer the question about dividing food or a small portion of food. If you want to divide food into small portion, you should know how to handle this food. Otherwise, this will cause a food poisoning. So sometimes people take food from other people to deliver it to poor people. When this food reach to these people, they get food poisoning because the people who work on this issue or work on dividing food don't know how to handle food according to food safety. So you will not find it in, people will not take this path to make a small portion. Other thing is from the beginning, people, there is some people in our community start to stop occasion food, to limit it to 1 day or 2 days, not too much. If you want to serve food, serve it for 1 day, not 3 days. That's it.
Just maybe to add, if I may, Dr. Webb.
Yep. Go on, last point.
Yeah, so, sorry, I lost my point.
I'm sorry. Everyone's anxious to get to lunch.
I think I don't want
We'll have more discussion, but so let's thank these 3 great presenters and panelists, and bring this session in the morning to a close. Thank you.
Thank you, Dr. Webb. Thanks as well to the speakers for such a very important and interesting session. So we'll have our lunch break. Before that, again, we'd highly appreciate it if you will all come back after lunch. And we need you to be with us till the very end of this symposium, especially today. The Minister of Health will be here at 4 o'clock. And I'd like to remind you as well on the posters room, posters presentations, if you haven't visited those posters yet, please do. We will be back exactly at 2:10 as we will start 2:15 sharp. Thank you very much and have a great lunch. Thank you.